Hello and welcome to our Doc Talk today with NorthBay Healthcare Chief Medical Officer Seth Kaufman. We're talking about COVID, the vaccines, the variants, all the latest information. Take it away, Dr. Kaufman.
Hey, good morning, everybody. Thanks for joining us. Happy April Fool's Day? Is that what you say on April 1?
No kidding. We're really here.
There are no April Fool's jokes in my talk, so just so you know. So let's start, as we usually do. We'll do some numbers. I'll give you kind of a high level, kind of what the news I'm reading, kind of the big updates that I'm seeing. Today is mixed. There's some encouraging news, and the punchline is also I think we're seeing signs of that we're going to slowly start having an increase in cases. I'm not going to call it a spike yet, but an increase in cases. So we're going to talk about that for the next 5 minutes or so, and then we'll go right into your questions. And of course, it's a doctor 5 minutes, so probably it's for like 10 minutes. Okay, so on that note, let's start with some of the highlights. So, what studies show a certain effectiveness for vaccines, right? But what you really want to know is what's happening in the real world. And so the U.S. just put out a study based with real world data, not phase 3 trials, showing that our vaccines are very effective, 90% effective. So it's really helpful. That reinforces those phase 3 trials. Pfizer also just completed their phase 3 study of teenagers, showing that it's effective and safe. So those are, Pfizer continues, and I know our other vaccine partners do too, but I know Pfizer best, continues to just study. They also, as we get farther away from that initial phase 3 group, they continue to test them to see if they still have protection. And we're up to 6 months now, and they're still protected. So all that is really, really encouraging. And it shows you a few things. Nobody is willy-nilly putting out vaccines. It is continuously studied in different groups. Seeing how long it's lasting. Does it work against the variants? And so on and so forth. Another update all around the vaccines is that while in a laboratory, when you took people who had been vaccinated and you exposed their serum to the South African variant, it showed some decrease in protection. But in real life, what it looks like, what they're seeing, is that it's equally protective. So that also shows you that when we hear in the news like laboratory studies show this variant may be less protective, this variant may not be as susceptible to the vaccine, in real life, it may be enough, right? It may be enough to have the same level of efficacy as the original, what we call the wild type, so the original virus that started everything. So and that's what we're seeing. So the news this week was that the South African variant, that the vaccines are very effective against the South African variant. The Pfizer vaccine is very effective against the South African variant. So that's my first update to you. The next update is just about cases and what we're seeing. So in Solano County, we are seeing a plateau and then just the start of an increase in cases. So I'm going to turn to my computer here and give you some numbers. Our 7-day positivity rate is 6.8%. All public information on the Solano County website. But just a week or two ago, it was really in the 4s. So that is not, we are in the red tier now. That is not going to get us in the orange tier anytime soon. And there is a risk that we kind of go back to the purple tier, right? We currently have 7, but as a flip side, we're not seeing a substantial increase in hospitalizations. So right now in the county, as of last night, the last time Solano County updated their information, they had 17 cases in the county that were in the hospital. It's a very low rate compared to where we were during the last spike. And we've been 15 to 20 for the last few weeks. So 17, it's not low. We've been lower. We were 19 the last few days. All those numbers, I don't know if that's slowly going to go up and down and start going up, or are we just going to sit there, or are we going to drop? The way to think about it, though, is the fact that we've vaccinated about 30% of adults in this county, and a lot of those are our highest risk individuals, older, with diabetes, right? Other things. Will we see a spike in cases, of positive cases, but not see a correlating spike in hospitalizations, including ICU admissions? It's possible. Or will it be muted? Like, it's all going to go up together, but will we not see the same level, which is really what we care about. We don't want anyone to get sick. you got to protect yourself, and we'll talk about that. But of course, the worst situation is when we hit that wall of we're out of ICU beds, right? People are getting admitted to the hospital, all the death, right? We really want to guard against that. That's the most important metric is, does the vaccine protect against severe disease? And we know it does. Last update is about the variants. I don't have a lot of new information this week. California is sequencing specimens, and they have criteria they used. We would love to all see more robust sequencing in the U.S. and other countries. We're not the most robust right now, but we have a South African variant in our county. We have some UK. We have some California variants. The predominant ones today in California is these two California strains, B1427 and B1429, and the UK. That's what we're seeing mostly. And our biggest concerns, because of virulence and death and things like that, was we worry about the Brazil one and we worry about the South African one. And across the country, what we're seeing is a just astronomical increase in the UK variant. And what the message there is, like, you may be asking yourself, Dr. Kaufman, what do I do with that information? But and the answer is get vaccinated, because it will be protective. How protective? I don't really know. But again, we just learned the South African variant gets squashed by the Pfizer vaccine. Even though in real life, even though in the laboratory it looked like it was a mix, we're seeing that a little bit with some of the variants. The California, UK, it looked like it was pretty protective. California in the laboratory looked like it was a little less, or it was a little less clear whether it was going to be protective enough. The reality is there's some protection against these variants and from the vaccine. So you should never, in your head, if you're deciding, you're invited, you have an opportunity to get vaccinated, take the first one you can get. Doesn't matter which one. The first opportunity to get vaccinated, you should get vaccinated, and you should not think like, well, I'm not going to because these variants are all over the place. That's not based on science or rational thought. Get vaccinated; it will protect you somewhat. If we all get vaccinated, these viruses won't mutate, and we won't have more variants. Like, if you want to also just squash the whole thing, let's get to herd immunity, right? And, there's going to be continued mutation. We're going to have new variants, and they're going to get farther away from the wild type. But the reality is that if we protect everybody and the vaccine is effective, we will contain this thing. If we keep going, if we sit here at 30% of adults in our county and we can't keep cranking that up, this virus is going to continue to mutate. It's going to become endemic. It already is. It's going to be endemic likely. It's going to be part of what we do. But I think you still have a really good chance, whether it's with a booster or whether with our vaccination efforts now, to contain this. I do believe that. Okay, I will stop there. That might have been 10 minutes. I might have stayed within the 5-10 minute range. And let's go to your questions. What do we have, Robin?
Well, let's talk a little bit about the variant and how you determine if somebody has the variant or the original virus. I mean, are we genetically testing every single one of these positive cases, or how's it done? Yeah,
so that's a good question. So the question is how are you detecting variants in California? We're going to stick to California. Okay. And the answer is that our state has a robust lab sequencing. It's called whole genome sequencing, WGS, and that's how you can tell whether you have the wild type, the original virus, or whether you or the specimen is from one of our variants, and they can tell. But that's a test that doesn't come back for a while, a week, 2 weeks. It takes time, and we can only they can only fill the machine with a certain amount of specimens every day and do the whole thing. So the California Department of Public Health and the county have created kind of screening criteria, and here's what they are. And I'm telling you kind of generally, there's more specifics, but people who have breakthrough infections after a complete vaccination, so 14 days after the last shot. So if it's Johnson & Johnson, it's 14 days after a single shot. For Moderna and Pfizer, it's 14 days after the second shot. Hope that makes sense. So if you got sick, and they want symptomatic people. So if you're testing yourself every week for work or because you want to and you don't have symptoms and you suddenly turn positive, they may sequence you, but they're really looking at symptomatic individuals who become infected after 14 days after the last shot. A reminder, by the way, that the vaccines are not perfect. So in there is definitely going to be the original virus and some of the variants. And they want that data because it tells us how effective the vaccine is against the variants, right? Another group is those with international travel or had obvious exposure to international travel. And I think 10 days prior to their positive, maybe somewhere around 10 days, I don't remember the exact number. And lastly, those who get reinfected. That is a hard one, by the way. If you're listening to this and you're like, I'm reinfected, it's 90 days. You definitely have, hopefully we're not symptomatic in between. People stay positive from the original infection for a long time sometimes. So just so you know, talk to your doctor if this falls in your, if that's a consideration. Just remember, like somebody who has COVID, their test can just continue to be positive from the original infection. So they want 90 days, a period of obviously not feeling symptoms, and still even after that, that's a tough one to decipher what was the original, what is a reinfection. Known exposure helps us a lot. Sometimes they might, if there's two people that are both get sick and one got a breakthrough infection from the vaccine, one was 90 days, maybe they both get tested to see if it's a variant. So those are the three big buckets of types of cases that they're sending to the state for sequencing. Our county lab is going full speed trying to set up their own sequencing efforts, and we know they're close and they're doing their best. And that is how you determine the variants in California.
Are the variants different from each other? I mean, does one cause more severe cases than the other? Or?
Yeah. So the question is do the variants act differently in our bodies and spread differently? They all do, and so yes, we know that it's that many of the variants can transmit more easily. Some cause people to be sicker and die more. Yes, and it's all about, a lot of it is that the spike proteins that we see images of all the time in the news, if there's enough mutations within that, sometimes it makes it so it can attach tighter to the receptors in your mouth and nose, right? And then maybe you get more inoculum, you get more virus, and that can cause you to be sicker. It is survival of the fittest, like everything. So the COVID virus just mutates naturally, and a lot of the mutations mean nothing. Maybe it kills the virus easily, and those just kind of go away. So you can imagine, like, wow, if there was a mutation that could cause easier transmission, would it survive longer and do better? And of course, the answer is yes, right? So that's why you see that natural. It's very organic, right? It's a natural life cycle of a virus to mutate, and those that create an advantage, right? A survival advantage are going to survive, are going to do better, and so on that note, by the way, is how do you guard yourself against that? Wear a mask, distance, hand hygiene. Purell is just still very, Purell and the other hand sanitizers are still very, very effective. It doesn't matter where that virus, what kind of mutation it had and which variant it is. So masks are still very, very effective. Remember, masks are not only effective at keeping, if you have it and you are wearing a mask, the chance of you spreading it is much lower if you're wearing a mask. And what we know, and I wish was publicized more early on, was also if you're wearing a mask and you get the virus, the chances that you get severely ill from it are a lot lower. It's almost like you got vaccinated if you're just wearing a mask. And the theory there is that and there's studies at UCSF that support this, that you get less of an inoculum, like, right? And totally, right? That probably makes sense to everybody listening. If you get less in your nose and mouth, your body's not reacting to as much virus. You're just going to get less sick. So it's not just about. Remember, at the beginning of the beginning of the pandemic, it was all about wear masks so you don't spread it. It's your public health obligation. It's also your own. It also keeps you protected from getting severely ill wearing a mask. Doesn't matter which variant, it's still protecting you. One more comment about variants, and that is about mutation. I had a question about whether it's normal for viruses to mutate, something like that. And so all viruses mutate at different rates. We know one that mutates faster than COVID does. Flu mutates much faster. Its mutation rate is much quicker than COVID. COVID is much slower. That's why you need a flu booster every year, because they They look at in the northern hemisphere here. We look at what happened in the southern hemisphere, the strains that are thriving down there, and the vaccine is based on that. And that's why it's not always 100% effective. It's often 60 or 70% effective. And by the way, that 60 or 70% effectiveness of the flu vaccine saves a ton of lives every year. And some years it's better, and some years it's worse. So the fact that we have a COVID vaccine that is 90% effective is amazing. And again, we can contain this virus. It mutates less than flu. We live with flu, and we do okay. COVID, it's a much slower mutation rate. These South African, Brazil, UK, California strains, the hundreds else that are out there that are just kind of small and we don't know about them yet, all of them are developed over time slower than the flu vaccine. So we can contain it. We can do it. Okay.
You talked about in Solano County that we've vaccinated 30% of our population. Is that correct?
Yes. The estimate right now is about 30% of adults are vaccinated in Solano County.
So what do we need to say we've achieved herd immunity?
Yeah, that is a good question. Dr. Kaufman, you're quoting approximately 30% of adults in Solano County. Is that herd immunity levels? No. What is herd immunity level then? I don't know. And a lot of it, and I say that I read as much as I can. These are all estimates because the transmission of that virus, which is really changes. And I think that people do not necessarily know. They do not know exactly where herd immunity level is. So 80%, 90%, 75%. There's a lot of numbers out there. The reality is it's not going to be like we reach a threshold and the virus just is gone. And maybe that's in your head, like herd immunity means herd immunity. It's going to be gradual. So I guess my point to you is every 10% that get vaccinated, we're going to see less and less of a impact of spikes and cases, right? So, it's not so much that we should be heading towards some goal of this percent. We should just get everybody vaccinated that can get vaccinated. And we know there's a population out there who cannot get vaccinated, all right? Very small population. Anaphylaxis to a portion of the virus and a few others, very, very few. That very, very few is way within the herd immunity level, right? So it's not that we won't get to herd immunity level. We can if people are willing, and we have supply, and supply is coming, by the way. What I see in my meetings with our Blue Shield administrators and our county and state data all show that supply is going to open up. For those of you who are listening who have been trying to make appointments, it is going to open up. And just keep doing it. Keep trying, and there will be opportunity.
Okay. Rosemary has a question.
Hi, Rosemary.
And she says, is the vaccine safe for young people in childbearing age? And is there any complications like infertility?
Yeah, there's no data showing infertility issues that I've read. You should talk to your primary care doctor, but there are no studies. There's discussion on blogs and things like that. There are no studies. Now, when it comes to really long-term questions like infertility, it is difficult to know 100%. And I know that probably is that doesn't excite you at that comment, but you have to remember, you have to do a risk-benefit. And if that requires a discussion with your primary care doctor, I respect that. Getting COVID really stinks. So nobody has seen in people with the natural infection. There are not studies showing in the big studies for the vaccine or the big studies with COVID for those with the fertility issues that I'm aware of. Pregnant patients with COVID, not the vaccine, are at risk for preterm labor and other complications. So it's also like getting COVID is really bad. Is there stuff we don't completely know about the vaccine because it hasn't been out long enough? Yes, but there's no data on fertility issues. I would encourage you to get vaccinated.
Thank you. Maureen is asking if COVID booster is needed could it be combined with a flu shot?
Yes, I think so. If a COVID booster is needed, can it be combined with a flu shot so we don't have to get 2 shots? Well, I hope so. I think so. I say that because there's so much the acceleration in vaccine technology has been incredible in the last year, right? So I think so. I haven't read any model where they're talking about that already. I do believe that there's constant progress in our vaccine development. Just this week, Pfizer talked about a freeze-dried version of their vaccine that won't require the same cold chain requirements, which is really important. Here at NorthBay, we have mastered the Pfizer cold chain. Like, we just know it. We had a singular goal of never having a wasted dose here at NorthBay, and we have mastered it. Our pharmacy leadership, amazing. But in a lot of areas where you don't have ultra-low freezers internationally and nationally, you need another option. Hence the attraction of Janssen or Johnson & Johnson. One of their, Janssen is a subsidiary of Johnson & Johnson. It's a Janssen vaccine and doesn't require the cold chain. So I do believe it, but I haven't seen any data on that or a story about it coming out. But I don't want 2 shots every year or every so often. I don't know if we'll need it. Again, it mutates a lot slower than flu. If we contain this, will we need like annual boosters? I don't know. I think if we can organize our vaccine efforts where we can quickly implement a booster faster than we have this year and a vaccine this year and get everybody vaccinated, as we learn more and we get better at it, I'm not sure it'll require an annual booster. Maybe one, I don't know. Here and there we might need something. We will see. That's an unknown.
Vaccine supply has been sort of an issue in the last couple of weeks.
It has.
Can you update us on what you know in terms of supply?
Sure. So the question is where are we with vaccine supply? We did have some issues. I don't know the origin of those issues. Like, it's not like I know more than you do. I do know more than you do about what's coming. I don't. It is a little of a black box, like what happened. We know what happened a few weeks ago, a little longer than that, when there was winter storms and transport issues. We all knew that. There has been a drop in supply. It's made it very difficult for our mass vaccination efforts in our county. I know our big health partners like Kaiser have done everything they can. It's been very, very difficult to get supply. That is now opening up again, but just starting. So if you're not seeing open appointments or things like that, it's not here yet. But it's just starting up. So coming into April, which is today, we will see an expansion of supply. Right now, there's several million coming in on a weekly basis, a little less than that, and it's going to double. It's going to double, and as we move forward, there are some projections that if we can match, if the supply comes in and there's no holdups, and there's all these ifs, like variables, whether it's weather or if there's a bad lot out there. I think Johnson & Johnson had a bad lot, and that was like 15 million doses this week. So, they're always testing it. That's what they should be doing. That should make you feel comfortable that there's constant safety checks, that it's going to be effective. If we can match that increase in supply, we could get every willing Californian, I know only about California, vaccinated in the next, 2 months or less, or maybe a little more. So I'm really encouraged, but the vaccine supply should be really going up exponentially, really going up and up and up. And there'll be ample opportunity. And that's why Governor Newsom is set today as 50 over, and then April 15th as all adults irrelevant of their medical conditions, because he knows, he's watching supply and knows that there should be enough. But there's so many factors in that, right? You have to get it, then we got to have that whole appointment system all set up. Got to have vaccinators to put in arms. It can't be anyone. You got to be a trained you got to know what you're doing to put the shot in the arm, right? All that stuff. If it's a 2-shot deal, you got to have that second appointment set up and have a system. So there's still a lot of work to connect all those dots to make it a streamlined system. We've done very well here at NorthBay with this. Many others have too. As the supply goes up, we're going to have to match that with these pieces. Blue Shield's trying to get that in place. Our county is, each health provider and vaccinator location is trying to be ready to expand as supply comes in. But in the last 2 weeks, there's been a decrease in supply, and that's what you're experiencing.
All right, you've mentioned Blue Cross now a couple times.
Blue Shield. If I keep
or
saying Blue Cross, it's Blue
I'm
Shield.
sorry, Blue Shield and the administrator. What does that mean, and how will it change where and when you can get a shot?
Okay, so the question's about Blue Shield. The state made a decision that we're not going to have each county, if they opt in, we're not going to have each county and healthcare partner who's providing vaccinations work independently. Remember, the state puts out kind of tiers, and when you can cross those tiers, but then each county assesses, have they gone through that tier? Can they move on to the next one? They're asking right now. The way it works, or it did work, is asking the state for supply of vaccine, what comes in, and then we try to use it as quickly as possible. And each county was working differently. If you're in Solano County, right, we have certain tiers we're going through. And if you drive over to Sonoma County, it's different. The goal was to create a unified system where you could go to myturn.ca.gov, sign up, and get a vaccine everywhere. And that would kind of even out. Like if one county is kind of getting full, you could drive somewhere else. You could see where appointments are open. And the Blue Shield was brought on to streamline that process and track the supply of vaccine and really create a single system. Creating a single system with 55 counties, whatever we are, 50 plus counties, and all those different, it's very, very complicated. It has potential, but right now it's in this transition. It's honestly, it's as expected, like trying to get all the little details worked out is difficult. That's why what we've told you on this call and what your doctor's telling you and what you're reading on in the news is to sign up with your own county. So for us here in Solano County, you go to solano.com. There's big buttons, buttons that say vaccine information. Fill out one of those vaccine information forms. It takes like 2 minutes, and so that you may be invited to our mass vax clinics. Also, go to myturn.ca.gov, register there. Have both going. Here at NorthBay, we're by invite, and we are inviting as many as we can. So be on the lookout in your email and your text. Look for it and take advantage of signing up now. So do all that stuff because we are in this transition with Blue Shield, and I think it'll settle down and be just fine. But right now it's in this transition. You should be having all your options open.
Okay. Are the 18 and younger population going to be given the vaccine in the near future?
Yes. Are 18 and older going to be...
18 and younger.
Oh, sorry, 18 and younger. Will 18 and younger be offered the vaccine anytime soon? Yes, 16 to 18 can easily get Pfizer. I think the 16 to 18-year-olds will have an opportunity very soon, if not in some counties right now. They have an opportunity now. Solano has seen a decrease in our supply, so the county has not opened up at the county sites to all 16 plus. But some 16-year-olds out there might have an opportunity today, but if not, it's coming. So let's talk under 16 then. Under 16, I don't know when. Pfizer just put out that phase 3 trial saying it's safe in the teenager years, 12 to 16. I think the push right now is, can we get kids, especially of that age, vaccinated before the school year starts? So if we can make that happen, that would be ideal. So I think that's going to be, they're applying for EUA for this age group now, is maybe sometime over their summer there will be opportunities for our teenagers to get vaccinated. Under 12, whatever age it is, somewhere around there, I don't know when that'll be. But remember, we know that the younger age groups, and I have to talk about the wild type here, I don't know the data on the variants, and the variant, especially the UK one that's kind of growing in prevalence. Remember that the younger kids are just less at risk for transmission. They don't have the same receptor density as adults do. Once you reach, this was studies early in the pandemic, once you reach 10, 11, 12, somewhere in that age group, some of the school age kid studies showed that it starts looking like adults. And I'm a little rusty on all those studies. It's been so long, and you got to trying to keep it all straight. Every week there's new studies. But so my point only about that is the middle schoolers should be first vaccination, and then we go younger. So the answer is I hope over the summer for the teenagers. That's really the summary.
Okay. Well, we're just about out of time. Our next chat is April 15th.
See you on April 15th. Enjoy the warm weather. Stay safe. Let's keep those masks up. Continue to be diligent, even as the county is in, we're in red right now. Maybe we will drop to orange if our little rise in cases goes back down. Just continue to be diligent in whatever you're doing. Don't, just be extra careful right now. It may not have to be that way forever. If we're all really conscious of what we're doing right now, we're extra careful, maybe we'll continue to just, really be able to contain this virus and even have more opportunity over the summer to do activities and things like that. Just be extra careful right now and have a wonderful April Fool's Day. Thanks.
Thank you, Dr. Kaufman.